Are you a CrossFit athlete being nagged by painful muscles and joints, but you don't want to have to miss the workout, scale movements, or use pills, surgery, or long periods of rest? In this video, I'm going to show you how to set PRs, perform at your best, and do it pain-free, and do so by having a solid pre-workout warm-up that you implement consistently with your training. So stay tuned and keep watching.
Hey, Dr. Jake Shock here. So what we're going to do is get started and start to just check for some of our common shoulder causes of pain. So we've got shoulder impingement, rotator cuff tears, trigger points around the shoulder, especially up here in our traps. We've got upper cross syndrome from basically just having too tight of traps, too tight of pecs. And then finally, we've got poor scapulothoracic stabilization. So we're going to show you a couple tests that just kind of quickly test all of those things, and then we'll get into a little bit of treatment here. So the first thing we're going to do is just have the patient go onto their back. So the first test we're going to do is just a clunk test. So we're going to have the patient go overhead here, and then we're just going to internal and externally rotate at the shoulder, listening for any kind of clunks, noting any types of pain. And we're really just checking for overall rotator cuff health there. It could be a good way to find a rotator cuff tear. And then from here, also what I'm gonna do is just check internal versus external rotation for the patient. So if I can do this without blocking the camera, I'm gonna have the patient come here. I'm going to stabilize him here at the elbow, and then I'm going to externally rotate him as far as I can passively, and then internally rotate him as far as I can passively. I can also have the patient do this actively just to see what he has, and then compare that to my passive ranges, and then let's go internal. Oh, he's got even more. Look at him go. So let's check internal rotation here. And we just want to be mindful of what his shoulder's doing so it's not jumping off the table, just to try to get a few extra degrees. So pretty symmetrical there. We want to look for some symmetry, and then also making sure that we have the required amount of range that we need for just optimum shoulder efficiency. Next, from this supine position, I can come around here and just check for pec tension or tightness. Basically, with him laying supine, what I'm going to do is just check to see that his shoulders are laying flat on the table. A pretty easy, simple test, just observing. We can give him a little bit of overpressure, but if his shoulder was hiked up off the ground, we can get our hands underneath here, especially like I can get almost a fist right there. He's obviously being a good player here and showing us what a bad test would look like. But as long as we're stable here and symmetrical, nothing too crazy to worry about. We can also just palpate for trigger points here in the pecs. And then the next test that we're going to jump to is a pronated load test for the biceps. So what we'll do here is bring him out and then pronate his hand there. And then I'm going to have him resist my pressure. So if he has any kind of strain of the biceps or tear of the biceps tendon, it's going to light him up because we're isolating that biceps tendon. So again, we're just going to abduct and then pronate his forearm there, ask for a little bit of resistance, and we'll check. And we can check both sides, but obviously if the side of complaint is what we're really focused on there. So we're going to have him sit up, and then the next test we're going to check is again for the rotator cuff, our empty can test. So we're going to have him get into this position here, thumb down, and then we're just going to give him a little bit of overpressure here, resist me here, resist me here. All right, and again, this is going to light up that supraspinatus tendon if there was an issue. So if he's not able to either hold his arm up, can't hold it with resistance, or there's lots of pain, then the rotator cuff might be something we need to investigate just a little bit further. Next, we're going to go with a full can test. I'm going to come behind him, and then we're going to adduct here. So here we're working, or we're checking a little bit more of the impingement side of things. So again, he's here. We're going to try to meet my pressure here, resist me. So he's trying not to let me push him down. And again, if that was going to be something that would light him up, then we know that there's an impingement case that's possible. So the next thing that we're going to do is then check shoulder range of motion. So I'm going to have him stand up. So Mr. Jones, can you please raise your hands as high as you can, straight up. So again, what we're doing is just checking to see how much room is in here, how high you can get them, are they symmetrical, is there any pain with it? All right, great. The next thing you're going to do is then go out to the sides, all the way up to the top. So we're just kind of watching overall movement, checking for ranges of motion, and then you can come back to the starting spot. And then finally, we're going to have you reach behind your back to try to touch your opposite shoulder blade. So we're going to see where you can get to on both sides, if there's pain, or how that looks. If he's really having to hike his shoulder up to get back there, then we know there's a little bit of limited range of motion. So Mr. Jones, we're going to have you go back on the table one more time on your hands and knees. So here we're going to check scapulothoracic stability, and we're going to do a 4-point rock test. So he's on his hands and knees, and what we're going to do is as he moves, we're going to pay attention to what the scapulas are doing. So we're going to ask him, Mr. Jones, please rock forward on your hands towards the top of the table, and then rock back. And we're going to have him go through this motion maybe 3 or 4 times so we can get a good idea. You can video this in office, but basically what we're doing here is just checking his shoulder blades to make sure that, especially at this point, you don't see one of them start to flare up. So we're looking for symmetry, good function. And then, Mr. Jones, do you have any pain with this exercise? Perfect. You can relax. All right, so let's go over a few treatment options here. So basically through our assessment and our exam, what we really want to do is classify this shoulder issue as either a stability issue or a mobility issue. And then that's going to basically guide our treatment from there. So in the case of a stability issue, our home run hitter is basically the DNS model. So dynamic neuromuscular stabilization. You can check out our channel for a bunch of other DNS exercises. In this video in particular, we're going to show you a shoulder uprighting video to basically properly load the shoulder, reteach the brain on proper loading techniques, and then loading that scapulothoracic complex or joint, and basically trying to reactivate certain muscles, turn off certain muscles, and get the health of that joint back to where we want it. So Mr. Jones is already set up here. Basically, you're going to have your femur and your arm parallel to each other. We're going to have him, he's almost off the back of the table here because we want enough room up here to move. You can see our other video basically talking specifically about this, but we're going to have Mr. Jones, we're going to say, Mr. Jones, give me some pressure here. So he's going to fill up his belly, proper interabdominal pressure. And then he's going to roll into his elbow. His elbow is going to be his contact point. And then from there, he's going to pop up. So driving into his elbow and then up, 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 keeping the head nice and long. He's working to create a straight line from his elbow through his shoulder to his opposite shoulder. So what we want to see here is some good extension here. We don't want to see the shoulder blade flaring out. And then we're going to ask him to control it on the way back down. Keep your pressure, keep your pressure. Good. He's going to reset, roll open. He's going to roll back towards the elbow, drive into the elbow, keep the pressure there, stay nice and long. And he's going to repeat this about 10 times. This can be a great warm-up. It could be a great rehab exercise. We love it, especially in office, but we'll often send patients home that need a little stability to be able to do this a few times a day, especially if they're going to be doing an activity later, a sport or an exercise or anything like that. It's a great warm-up for that. So the next thing that we're going to do for a mobility standpoint is have him go on his back, and we're just going to do a quick PIR for internal and external rotation. So we'll pretend that he is deficient in external rotation for his left shoulder. So we're going to come down here. I'm going to block his shoulder. So we're going to come down. All right. So I'm going to stretch him passively to a good spot. All right. And then I'm going to say, Mr. Jones, push into my hand. So he's driving into my left hand here. We're going to count to 7 and then relax. And then with that, we're going to try and stretch him just a little bit farther. Are you doing okay here, Mr. Jones? Just staying in tune with the patient. You can kind of watch their face for grimaces and anything that would indicate that they're uncomfortable here. So we're going to have him press against my hand again. We'll count to 7 again. 6, 7. We'll have him relax, and we'll try to take him even further. So a couple rounds of that, and then we can recheck. So we'll go back and we'll look at what his new external rotation is. So oftentimes with this, even though mobility was a problem, we can come back after we've given him a new range of motion of mobility, hit it with some stability, so now the brain knows what to do with that newfound range of motion, and we can go from there. Some other things that we really love for the shoulder is dry needling, especially for any trigger points in the trap or the subscapularis, the lats, can often contribute to shoulder blade pain, anterior shoulder blade pain, or even range of motion deficiencies. Or we can just hit it with some quick ART, given the specific muscle, about 5, 6, 7 passes. And the patients always seem to like both of those options. So stay tuned, and we'll go over a quick warm-up for your shoulders before you get ready to exercise or work out or a sport. So stay tuned. All right, so we're going to go over a few treatment options that we would do in office. This isn't end-all be-all here, but this is just a little sample of kind of what we can or could do. So the first thing that we're going to do for Mr. Jones here is we're just going to go over a little bit of ART here for his subscapularis. So we're going to bring him up here, internally rotate the shoulder, and then I'm going to pin him down and just take him through a couple ranges of motion there. So we're going to go about 5, 6, maybe 7 passes. And then after that, we could come back and check to see what range of motion looks like. We're going to check for tone, tension, or trigger points there. The other thing that we could do is dry needle the same muscles. Pretty much any of the muscles that you're going to do ART on, you could dry needle. So we could dry needle subscapularis or any of the teres group, or we could even get up into supraspinatus and dry needle it if we wanted to, or even just like if he's carrying a lot of excess toner tension in his traps or pecs, we could just go after that, and patients seem to usually like that and respond pretty well. And then the last thing that we can do is we can just go with a little bit of an adjustment for him. So what we can do is we're going to adjust his posterior shoulder capsule. So similar to the hip, we're going to come in here, bring him up like that, and then depending on where his ranges of motion was, we're going to have him kind of fold his elbow across to his opposite side, and then just drive him into the speeder board. If that's too much and it's pinching too much here, we can just kind of go straight up and then and down. So we can kind of work a bunch of different ranges of motion there. If you have a drop piece on a table, that it could be even better. You could go for a little pec release But those are just some quick kind of easy treatment things that we can do in office, and just to kind of work on pain and working on some of our tone and tension, trigger points, and some of our other functions that we're going after here.